The recent high numbers of reported tuberculosis cases are alarming. For the past 2 weeks, the Free State Health Department's district outbreak team is on high alert. It is conducting daily monitoring, contact screening, and testing campaigns to curb the spread of TB in affected areas.
The community health workers, they go to that place, either a household or the workplace, to screen everybody that is working there or that is residing in that household. So that's when we received the first case, and then they went to the school, to the same class to screen, and then we got one other case. Then we decided that we need to screen more classes at school. And then when we came to a number of 4, that's when we decided to, from the 11th of November, that's when we decided to sit at the school and screen the whole school. And then the numbers were becoming high every day. Even now, we are still getting the positive numbers because the NHLS, which our laboratories, was overloaded with the specimens that were too much.
TB is an airborne disease, meaning anyone can get it by just breathing in the contaminated air. It can affect any part of the body. However, when it has affected the lungs, it is called pulmonary TB, which becomes infectious and can spread from one person to another. Health officials are on the ground, ensuring that they curb the disease.
This can have many impacts or many sources, because we got only one teacher that was also positive, and when we went home to screen the family also, they also tested positive. So, and our children to the school, they are also traveling in the transport that are driven by elderly people. So it has got a lot of implications, and maybe a lot of people that has infected the children at school. Like for instance, here at the clinic, as you can see at the back, it's parents that has brought the children that were contacts of the school children. And it's not only children that they were not having any positive case in a class. In a class whereby we were having positive cases, that's where we are screening the contacts, and we are also giving them the prophylaxis that will prevent them getting TB in future. But we don't only stop there by giving them the treatment. We check them on monthly basis to take the sputum to see if they are not developing TB.
Some TB survivors are encouraging those infected that they can fight the illness.
Ke qadile ba le yona ka 2019 ha ke tla tseba ka yona TB, then ka nwa treatment ya teng for 6 months ka enwa ka fola.
He says he first got TB in 2019 and took his medication for 6 months, where he completed it and was healed. Last year, he was once again infected. This time around, he says he got it while he was nursing his girlfriend who had TB. He says when he went to test at the clinic, the results came back positive and was told the type of TB he had was different from the last one. It was a stronger one called MDR. He says he then started taking the TB medication till September last year, but defaulted and was then taken to Moqhaka Hospital in Tabanchu for 2 weeks and was sent back home where he completed his medication.
Tabanchu. Then Gadula for 2 weeks fela ba mpha dipidisi ba re ke khutlele hae, then ka khutlela hae ka tlo qetella treatment ya ka hona mona.
2020 I was coughing for 2 weeks, then I was sweating, then I decided to go to the clinic. Then when I go to the clinic, I said to them, I asked the sisters to test me for TB. So then they test me. After that, they tell me that I have TB. They tell me that I must start taking treatment for TB. So I did take my treatment for 6 months. Then during that course of taking treatment, I was emotionally affected and physically affected. But here I take my treatment for that 6 months. So I like to tell people that they must take their treatment for the duration that the nurses or the doctor tell them. TB is curable, it's not a death sentence.
The department is requesting the community to not panic.
this crisis of the high numbers in one school, for the first time I've been in the program, I'm experiencing it. It has never happened before. But the advice that I'm giving to the community, and especially the parents of the school, is to say whenever we have a positive case, let them allow our community health workers to go to the homes and screen and test those that are at home, because it is very important to screen the contacts also. I would like to plead to the parents of the school especially, because there is some issues on the social media especially, whereby they will be saying why should the children get prophylaxis while the schools are closed? They're not going to meet with those children quickly. Remember the TB bacilli. It's a bacilli that can sit in your body and you are not active. Everybody has got it, in fact, but it's not active. Immediately your immune system drops, then it will cause an infection.
Now that the schools are closed, the department revealed that it is having challenges tracing other learners who have tested positive. Health officials have been prioritizing awareness and education about TB, what can be done to curb its spread, and have also been providing information on what to do when one is infected with the airborne disease. Reaitumela, SABC News, Kroonstad.